Hi, my name is Dr. Al-Ghazali. I'm an orthopedic sports medicine surgeon. Meniscus tears are really common orthopedic injuries. It's actually the most common surgery that we do because the meniscus itself doesn't have the best blood supply. But there is a lot of misinformation or misguided treatment out there on the internet. So I wanted to make this video to help guide you in how to choose the right treatment option that's best for you depending on the meniscus tear that you may have. In this video, I'll cover common ways that people tear their meniscus. I'll also talk about how we diagnose the meniscus tear and also what the treatment options can be for you to get you back to playing sports and living a pain-free lifestyle. So meniscus tears, again, are really common injuries. The meniscus doesn't have a really great blood supply. The blood supply comes from the periphery, works its way into the center, and that leaves that center part and even some of the peripheral parts at risk for tears. And when they tear, they tend to not heal. What we know about meniscus tears is that if we scanned everybody walking the street, there's going to be people with meniscus tears that don't cause them pain. And that tells us that we could probably treat a lot of these without surgery, right? We can treat them with physical therapy, anti-inflammatories, and kind of activity modifications. The most common way that people tear the meniscus is a twisting and pivoting type injury. This catches the meniscus, and again, that small kind of friable piece can tear, and then that tear can cause pain. We tend to get x-rays and then subsequently MRIs to really diagnose a meniscus tear. Depending on the type of meniscus tear, again, you may be in a category that we can treat you conservatively. If there's small radial tears in the center of the meniscus, a lot of times we'll try the conservative approach and see if we can get you better and pain-free without needing a surgery. Ultimately, a lot of meniscus tears, again, don't heal. And if we fail the conservative approach, then we tend to pivot and start talking about operative indications and treatment. Some meniscus tears are very clear indications for a surgery. If it's a large peripheral tear in an area that might heal, we tend to be a little bit more aggressive about fixing those because we want to prevent that tear from propagating and getting larger with time, which the research has started to show that happen. If it's a large bucket handle tear or a big lap of meniscus that kind of flips over, that can cause your knee to lock and you have feelings of instability, but also inability to fully extend or fully bend your knee. Other symptoms of meniscus tears are pain with bending, squatting, stairs, or pain with turning, pivoting motions. Treatment options again include conservative approach. This is the first time that you've experienced a tear and it seems to be a small enough tear on an MRI. If you fail that conservative approach, then we start talking about operative indications. There's really two approaches to treating a meniscus tear arthroscopically, meaning two poke holes in the front of the knee, and we go in with a camera and we decide what we need to do. Sometimes a meniscus tear and the tissue is not something that's amenable or able to be fixed. In that scenario, then we're talking about a meniscectomy or a cleanup type procedure where we're taking that torn piece that may be catching and causing mechanical symptoms out of the knee. In that situation where we're doing a meniscectomy, the recovery tends to be pretty quick. Somewhere between 2 and 4 weeks, most patients are back to doing what they want to do. There's no real restrictions. There's no limitations in bending or activity. The other option, when we go in there, if the tear is large enough, and again, including that bucket handle situation, we might be talking about fixing the meniscus. This is a meniscus repair. There's a lot of different techniques on how to fix the meniscus. There's a lot of different implants that we can use, whether it's all inside suture devices, inside out type techniques, or outside in. All that being said, we try to repair that torn meniscus tissue. If we repair the meniscus tissue, the recovery is a little bit more involved. We tend to protect your weight bearing and we protect your range of motion. We use bracing to help guide us in how much range of motion we allow in your knee. And physical therapy is absolutely part of the rehab protocol. We want to gradually improve your range of motion in a safe way. And from there, we start layering on the strengthening. Recovery for that is somewhere between 3 and 4 months. To get back to cutting, pivoting sports, I would tell you it's probably closer to 6 months before we'll let you do those kinds of activities. Again, it's really important to find the right surgeon for you. If you have a meniscus tear, seek out an orthopedic sports medicine specialist. If you found this video helpful, feel free to like and subscribe. Send any questions my way via email, or you can call the office to make an appointment at 212-737-3301.